And one of the things that so that speech therapists were terrible, but then I saw him receiving help that he needed from a speech language pathologist in a medical setting, and then that's kind of where I realized it was a much bigger field than what I had initially thought. I didn't go into speech path right away after that, but it did kind of contribute. I'll talk you through some significant events that kind of led me here, describe what an SLP is, and then we'll talk about settings and experience. Along the way, feel free to chime in with questions as you have them, but we'll also leave time at the end. The most important thing in communication is hearing what isn't said. As a speech language pathologist, I have to listen for a lot of things. I'm not just listening to have a conversation. A lot of times I'm listening to understand how someone is thinking. I'm listening for how they're feeling, but I'm also listening for how their ability to produce speech. Like, are they speaking clearly? Do they have enough breath support? Those kinds of things. So as an SLP, you just learn to listen in a lot of different ways. How I got here. I graduated from Red Mountain in 2004, and I did my first 2 years of undergrad at Arizona State. At the end of that 2 years, I was a criminal justice major, and I was like, I don't know what I'm doing. Like, this is not the field for me. I have no idea what I do want. I'm not going to college anymore, and I dropped out. I decided to go live in Idaho. I have family up there, and I love hiking. I love camping. I love all the things. So I was like, I'm going to go to Idaho. And I lived in Idaho for a year. Then I decided to go into creative writing. Very lucrative, let me tell you. So I went into creative writing, but there was no program in Idaho for that. So I ended up in Nebraska. They had a really great creative writing program. I majored in creative nonfiction and like a journalism type track. And then also I focused on linguistics, which is like the study of language. While I was in undergrad doing that, that is when I had the boyfriend who forgot me. So I went ahead and finished my program, and then I wasn't sure what I wanted to do next. So I took a year off again. Took me a long time to get through school. And I'd had this recent event or experience with my boyfriend who had needed a speech pathologist. I also had this background in having like the criminal justice as my undergrad, and I was interested in law school. And I knew now that creative writing was not going to be a way to support myself. So I took a year off, I leased apartments, and ultimately decided on speech language pathology as my next focus. And so I got my master's. I lived in Nebraska up until 2022, and then I came here to Arizona and ended up back at Red Mountain where I started, which is, life is funny. So here we are. What does an SLP do? We do a lot of things. We work medically and we work in schools, but we work on things like speech, our fluency, our ability to sort of communicate the thoughts that we have. One of the things that people don't often think of is like swallowing. We use all the same structures to swallow as we do to speak. And it affects our airway as well. So a lot of times when you work medically, it's tons and tons and tons of swallowing evals, diet texture recommendations, trying to decide if somebody is safe with whatever diet that they're on or put on, and what you can do to kind of change that. I linked a couple videos in here. Let's see if this works. Oh, it won't let me.
Is it right there?
Yeah, it's on. Can you do it from there? So one of the things is like after somebody has a stroke, if you're going to be a stroke certified hospital, you have to have an SLP evaluate that patient within 24 hours. Yeah. So this person has had a stroke and it has affected their language ability. This is Broca's aphasia. There are different forms of aphasia. So,
can you tell us your name?
Mike Caputo.
And Mike, when was your stroke?
I was 7 years ago.
Okay.
And
And what did you used to do?
Worked Autodesk, seven sales and worldwide, and very good, yeah.
Okay, and who are you looking at over there when you turn your head?
That's my wife.
Okay, and why is she helping you to talk?
She's a speech.
So you have trouble with your speech?
Yeah.
So you notice that this type of aphasia is characterized by having difficulty figuring out what words you want to say. He's thinking clearly. He knows exactly what he wants to say. He knows what that person is in relationship to him. He knows what his job was before. But the brain, through this stroke, has severed communication between being able to have the thought and being able to put it into words. I want to contrast that with another example. So let me know. He is also a stroke survivor, and he has fluent aphasia.
Hi Byron, how are you?
I'm happy. Are you pretty? You look good.
What are you doing today?
We stayed with the water over here at the moment and talked with the people over them over there. They're diving for them at the moment. They'll save in the moment. He'll have water very soon for him. With luck for him.
So we're on a cruise and we're about to
We
get to
will
Juneau.
store it right here and they'll save their hands right there for them.
And what were we just doing with the iPad?
Right at the moment they don't show a darn thing.
The iPad that we were doing. Like here?
I might change for me and change hands for me. It would happen. I would talk with Donna sometimes.
Very different, right? Very different forms of speech, very different results from the similar thing that happened. They both had strokes, but one of them has Broca's aphasia, which is difficulty finding the words. So you'll notice that his speech is almost telegraphic. He can't speak in complete sentences, the word finding is impaired, but he has good thinking, and he's aware that he's having these troubles. He's engaged with his speaker. But the second one, that one's called Wernicke's aphasia. His sentences were, fluent. They came right out. He didn't have to stop and think, but did anything he said make sense? No, nothing he said made sense. That type of speaker has no idea that they're not making sense. So they can be really difficult to work with. But those are like two kind of ways that a stroke can impair your language or your language centers. It can also affect, and not just strokes, but like a brain injury could do this as well. Usually those specific ones are associated with strokes, but brain injury also affects like your ability to pay attention, your ability to remember, and that's what happened with the boyfriend that I had. He, a year later, did finally remember that we were dating, and he came back to me and he was like, I'm so sorry, like I had no idea. And the way that he described his memory, when you and I make memories, we put them in a sequence, we put them in order, right? I remember what it was like when I was 5, I remember something that happened when I was 7, and I remember something else that happened when I was 9 or 12 or whatever. And we have a timeline of events that's created in our mind. How many of you have seen like a stained glass window? He described his memory as a stained glass window, where all the little pieces are there, all the colors, and they all make up this big picture of who he is, but there's no sequence, right? It's flat. It's one-dimensional. So he had no idea that we were dating at the time of his accident. He just knew that we had dated at some point and later put it together that it had happened then. And by then it was too much time, and we both had moved on. But those are some of the wild things that can happen to your brain, and that is something that I love about my field. So I love being here. I love being an SLP at Red Mountain. It is probably my favorite job I've ever had. But as far as being a speech-language pathologist overall, my favorite thing is the fact that I can work with so many people in so many different settings and circumstances, and I always have a job. If it gets too much to work medically, just because that's an emotional setting, then I can always come to the schools and vice versa. Some of the things that can happen to anatomical differences, SLPs will work with this a lot. This is a cleft palate. So this is a baby that was born and the roof of his mouth is open. So when he eats, where do you think his food goes? Right out his nose. You put a spoonful of baby food in there and it's coming out his nose. Can that baby survive? No, not without help. So an SLP, a dietitian, the medical team, everybody's going to kind of come together and create a plan for that child depending on the severity of this, of the cleft. Sometimes they're just little, and sometimes they're like a submucous cleft, with all that means is that you still have the skin on the roof of your mouth, but the bones didn't fuse. All kinds of things, but that's, you know, our field is just so huge and there's so much that you can do with it that it's just been an amazing gift in my life. And here's my why. The limits of my language are the limits of my world. I love that every day when I go to work, I am helping families and students and patients and whoever become more connected with people around them. Whether that is through helping a young child or an older person get set up with some sort of communication device so that they have something that says words for them, whether that be improving somebody's vocabulary so that they can think of the words they want to say. There are so many patients out there who can't say I love you to the people they care about. And that's something that I get to be a part of on their journey. It really is an incredible field, and especially as an extrovert, which I am, I just think it's so important to be able to connect with the people you care about. So if you choose to be an SLP, you need to have a master's degree. As part of the completion of your master's, you will need to do an internship and an externship, which is basically just like a school setting and a medical setting, like you complete. And then when you are finished with your program, your intern and externship, you'll take a national exam, which is your praxis. You'll take comprehensive exams at whatever school you're in, where they ask you questions about every single thing from your master's. And then you'll get your master's degree, and guess what? You are not done. You get to go for a whole year being supervised before you're actually deemed an SLP, or you have your certificate of clinical competence. So for the first year, it's more of like a medical model, where like if you were to be like a doctor or like a pharmacist or any of those kind of professions, because you're diagnosing, you need a year working underneath a licensed professional. And that's what that clinical fellowship year is. Employment settings, there's a ton of them. I have a friend, I think she has the coolest job. She goes in, she's at a university, but it's also a teaching hospital. And so she goes in while patients are having brain surgery, and she performs live language evaluations to make sure they're not harming the language centers during surgery, which is like wild. So there's like an open brain right there. In grad school, I held a brain, a human brain. That was kind of wild. It's not as big as you think it's going to be. It's literally like, our brains are literally like this, but it fits right in your hands.
So it's not that big?
No, not that big. Yeah, it's just little. Our brains are really wild places, and you really have to understand a lot about the brain to be an SLP. I took a traumatic brain injury course. You take neuro, you take anatomy and physiology, but it focuses on speech and hearing science. So it's like how your brain communicates with your body and what parts of your body it does that with. This picture that I have up here is an X-ray, and it's of a modified barium swallow study. So if you are having trouble swallowing and you're in the hospital, they may recommend that you have this done, and it's actually done by a speech pathologist. The radiologist comes down and runs the machine, but the speech pathologist is the person who interprets it, who provides, it's called barium, but it's a radioactive substance so that it'll show up on the screen. In this picture, you can see the barium is this white stuff, and somebody has taken it, they've swallowed it, and it's coming down. This is the trail into their stomach, their esophagus. This is their trachea. And so we can see on this study that this person has, I'm guessing it's a liquid because it's not in a solid bolus, but so this is probably like something they drank, not something they chewed up. And we can see that trace amounts are going into the trachea and down into the lungs. I'm guessing this person has had like repeated pneumonias, they have respiratory distress, and during this x-ray, they'll have the speech path will cue the person to sit in different positions and retry, and they'll change the texture so that when they walk out of the x-ray, they know what foods are safe for them, or at least the medical team knows what's safe for them, so that when they go back to their facility or when they go back home, they know what they can eat and drink. You work alongside a ton of professionals, just depending on your setting. Teachers, nurses, respiratory therapists, doctors, just all kinds of things. Oh, last time we also talked about visual neglect. You can have a stroke and your brain will stop. There are places on the right side of your brain that if you have a stroke there, your brain will stop paying attention to anything on your left. Anything. You can feel it, you can see it, you can hear it, but your brain just decides that's not a big deal and doesn't listen to you. So I've seen people get like their arm wedged in their wheelchair and they can't go because their left arm is like tangled in the wheel. Only because their brain is not paying attention. They don't know their arm's all tangled in the wheelchair. Or you go in to talk to somebody and you're on their left side and they don't know you're talking to them because their brain has like shut off any input from the left side, even though their ears work just fine. Visual scanning becomes hard for them. They can't navigate their environment. So even if they can walk, I mean, it ends up like this, where the left half of their body is just like bumping into anything. They have no idea. Or sometimes they'll end up going in circles like this because they're like not using the left half, even if they can stand on it. Is anyone interested in any of these fields? Or areas? Any interest in here in like medical or therapy? No? The other thing is traveling. If you're interested in nursing, speech, PT, OT, any of the traveling fields, you can make a ton of money. When I've done traveling contracts, my take-home pay after taxes and such was about $1,500 a week, which is a lot for anyone.
So did we talk about this class about how you do work here during the day, but then you do go do your services at night,
yeah.
correct?
Yeah, so I work full-time in the schools.
So every person get paid for that, yeah.
Yeah, so I work full-time in the schools, and that's where I get like my benefits, my health care, all the things. I'm a single mom, so it also helps me provide health care for my kids. But then I also work at a behavioral health facility / long-term care facility, and I basically contract my services to the facility. I don't get any benefits from them, and I only work when I want to. So if they call me and they say, hey, we have these evals, I am free to say no whenever I want. I don't have any obligation to them. But whenever I need hours, or if they, like, I can go in and work at my leisure, basically, only when I want. That type of work in Arizona, you usually make about $55 an hour, $55, $60 an hour. I make a little higher than that, just because of my experience and stuff, but that would be like what you would expect, is about $60 an hour. So then you think about that with between my full-time salary and then between this hourly rate that I get, I still have a ton of time off during the year, and I can use my vacations how I want. Like in the summer, if I have no obligation to that company, I don't have to go in. I can still use my whole summer, and I'm making, you know, six figures, 100,000 usually a year. Trying to think. I think most positions as an SLP, if you've been doing it, you should expect about 100,000 in Arizona. Different cost of living, different situations, but for us, you should expect about 100,000. I would say the lower amounts might be when you're starting as like during your clinical fellowship year. And then if you don't want to work as much, then obviously your rate will be decreased, but you're probably going to not work as much because you're out living life or doing whatever it is that you need to do. But working full time, you should make about 100,000. Yeah, and have benefits and all the things. Settings that I have worked in, I've worked in hospitals, so I've done the swallow x-rays. If a hospital is going to accept potential stroke victims, they have to have a speech language pathologist evaluate within the first 24 hours, or they cannot take stroke victims. So tons of what you do in acute care is evaluate. People don't stay in hospitals very long. They're usually only there a couple days. And so you're evaluating them, and you're helping determine what their next placement is going to be. Can they go home and receive outpatient services? Do they need more support? We will talk about the shovel guys now, because this is useful for them. So I've had 2 different patients who I've seen in different settings who happen to have been like beat with metal objects and had severe brain injuries because of it. The first one, he was beat with a crowbar in a parking lot. What happened was there was a girl there that was like, he witnessed getting hit by her boyfriend, and he stepped in, but then the boyfriend and his friends jumped him. And so he ended up with a severe brain injury, and he's in the hospital now, or he was. And he was in the hospital, he was in intensive care, right, until they kind of got him medically stable. And once they got him medically stable, he transferred to more of a long-term acute care rehab unit where he could receive skilled services, and some nursing needs that he still had. Because your brain takes a really long time to heal, I mean years. And even in the first year is when you're gonna see the most growth or change. He was not ready to go home. His memory had been severely affected, just like my boyfriend's had been. And so he just needed more care before he could get there. And SLP is who's gonna help determine that, because we're gonna look at how is the brain functioning, how is his memory functioning. Currently I'm working with a guy, I don't know why he got beat with a shovel, but he was also in a parking lot and he got beat with a shovel. And now he was in the hospital, then he went to rehab, and now for at least the next year, he's in like a facility who can help with his needs. So one of the things that's happening with him is he's hungry, okay? He'll get hungry. So he'll order DoorDash. How long does it take for DoorDash to get to your house?
Like 20 minutes.
20 minutes. Yeah, 20 minutes, okay? In that time, he's still hungry. So what do you think he does? Remember, he's got a memory impairment. He can't remember short-term things. So he orders DoorDash again, yes. So he orders DoorDash, and in the 20 minutes until DoorDash gets there, he orders DoorDash again. The first DoorDash comes. Oh, great, I was so hungry. I'm so glad this food is here, and he eats it, okay? Second DoorDash comes. What do you think happens? He eats it because he forgot that he ate. So not only is he forgetting that he ordered it, but then he's forgetting that he ate it. Is that a person that you think could potentially live at home alone? Do you think they could live at home with one person? Who's going to keep an eye on that? Like every 10 minutes, who can take care of somebody that well? Nobody, right? So he's one that we're working on using like external supports to help with memory, like having him track his meals, track his medications. He's on a ton of medications. He has to take salt pills like every 3 hours because it facilitates brain growth. He's taking some medications for like seizures. Can you imagine if he forgot? If he forgot, he would be in a world of hurt. So right now he definitely needs the support. He's a pretty young guy, he's in his 40s, and he can walk just fine, but there's a lot of things that affect your ability to be at home or to take care of yourself. And one of those is memory, which for him is just lost right now. I described the mosaic, right? No?
Yes.
Okay. I was like, I think I did that this hour. Yeah. Yeah. So memory works in kind of a funny way. So does language, or being able to say like what you're thinking.
You talk about
What?
your patients been on death of their deathbed.
Yes. So I was like looking like, what's my thing? End of life. So another thing that happens with SLPs is we get called in like when patients are getting close to death or like really old. And they'll say like, can this person eat and drink safely? Recently, like within the last month, I had a patient where they were like, hey, this person's not eating and drinking like normal. Can you come in and evaluate and see kind of what you can do? I went in and I saw the patient and I evaluated. And when I was leaving, I told the director of rehab, I said, you know, I didn't recommend a diet for this person because they didn't seem safe to eat or drink anything. I said, but I also didn't write goals for them because I think by the time I come back, they're going to have passed. Like, I don't think they'll be alive anymore. I said, if they're alive, I'll reopen the eval and I'll write goals. Sure enough, it was that weekend. So it's like, it's something that you like become attuned to. And I mean, he was ready. He was really old. It was not like it wasn't like a sad thing, but it does get hard to kind of weigh that in your heart. And sometimes it is a really sad thing, or like with patients or with families. I had one that I remember very vividly. He was an amazing person. He was actually a pediatrician. And it was the first time that I really thought that the way I'm watching his swallow deteriorate here, because he was in skilled rehab, and we started initially, and I was like, oh man, I really don't think this is rehabable. And so I had to call our rehab team together, let the medical team know, and we called a family meeting. And I had to explain to the family that I really didn't think his swallow would rehab and that he would be able to eat and drink. And that I really thought this was like an end of life consideration. Like, do you guys want to consider hospice at this point? Or do we need to, like, you guys can think about a feeding tube. Like, that's a question for your doctor. He did end up passing within a few days. But you can, as an SLP, sometimes you're on the front lines of that communication with like the patient and the family, just because you're watching what's happening with their body. Yeah, schools are a lot happier. But do you guys have any questions or?
So no questions?
None?
Nice.
Okay.
Cool.
Yeah.
All right. So if you guys want to give Miss Kay a hand for coming down, and yeah.